Hi, my name is Logan. I am a RN at Ruby Memorial Hospital in Morgantown, West Virginia. I've been a nurse now for about 5 years. Started out as an LPN, working in a small hospital in rural West Virginia. One thing that I figured out when I worked there, I don't really like to work a specialty as much. So I kind of floated around. I worked ER, ICU, telemetry, med-surg, obstetrics, and that kind of transfers to where I work now. I work now in the EICU at Ruby, which is generalized ICU. We have EI patients, we have MICU, SICU, neuro, and sometimes even CV patients. So we see a lot of different illnesses, treatments, just a bunch of different cool stuff. Another cool thing about all of us is we're all cross-trained to work in every single step down, every single ICU, all the way across the level 1 trauma center. I started my schooling out at Fairmont State, but I also went to a technical college for my LPN in Buchanan, West Virginia. And then now I'm back at Fairmont for my BSN. One thing that I do like to do, it's kind of dumb, but I love to learn about like useless medical facts that you'll never use except for probably one time in your life. One thing that I think is very interesting is a drug we have called methylene blue, and it is actually a textile dye, but they use it for symptomatic hypotension, but they only use it in certain cases on forepressor shock. You can also give it for various blood disorders, and the way that it ended up getting discovered what cells that it hit was because they gave it to a bunch of people, and then they did autopsies and they found that their brains and their hearts were blue. So yeah, for this course I would say that teamwork, collaboration, and patient-centered care as well goes into the QSIN competencies. All patient care should be patient-centered, should be relayed to the whole team, to the patient, the family, make sure everyone's on board. If not, to make sure everyone gets on board. One of my goals, so after my bachelor's, I want to transition into flight nursing. I want to do that for a little bit, then later on transition to either an NP role, and then I would like to be a AGNP or a CRNA, and then I would love to teach. I really do like to have people that are newer around me so I can show them things that I know, and I always learn new stuff in the process as well, which I think is great. My question for other people would have to be, what's your favorite medical fact and why does it interest you?